Sioux Falls hospitals have been at or near capacity for months as the pandemic continues.
But healthcare leaders say the strain on both health systems is not all due to COVID. It's also the result of the explosive population growth across South Dakota.
Avera McKennan is almost full every day.
It's a similar story at Sanford in Sioux Falls.
Last week on a Wednesday, we set a census record. It has nothing to do with COVID. It's everything to do with population growth.
But it's not just Sioux Falls residents filling these key regional hospitals.
56% of our patients come outside Sioux Falls.
We do see patients that come really a couple 100-mile radius for clinic appointments as well, depending on what type of medical specialty they would need to see or a surgical type specialty, where we do those procedures here, not in those outlying communities.
Both Avera and Sanford are working to grow the care patients can receive at their local network hospital to help take some pressure off of the increased traffic in Sioux Falls.
Within Sanford, we have a number of critical access hospitals. We have larger facilities, say in a Aberdeen or a Worthington or a Chamberlain. What COVID has really helped us do and helped push us is really how do we utilize those beds to a different capacity.
We tend to say if our rural network is strong, Sioux Falls will be strong. And that's very important that we have good institutions out in Gregory and Miller and Millbank, because they ultimately will send their patients to us. So that's been a growth strategy for us as well.
While the benefits of providing more localized health care are clear,
patients can stay in their community, they can stay where they're close to their loved ones, their families. We know people heal faster and their outcomes are improved by doing so.
Growing that rural network is more than just building facilities. Their main challenge is bringing in healthcare providers.
It's a challenge in Sioux Falls, but in some rural communities, it's a much larger challenge.
One that's become a little easier this past year as more people look to move to the state.
We have seen numbers of people wanting to leave bigger cities for South Dakota this past year. That's been a strength for us as we're trying to manage this growth.
But in order to serve the growing population in Sioux Falls and across the state, Avera and Sanford say recruiting more workforce is essential. We have a look at the plans for growing care and access to new healthcare facilities in Sioux Falls. That's coming up in tonight's Eye on KELOLAND at 10.